As far as type 2 diabetes mellitus is concerned, at the start of the disease, you can manage it very well with diet, exercise, the proper diet, and exercise, plus the current medications. In fact, for those who have been diagnosed really early, some of them would have type 2 diabetes in remission, meaning they would be without the medications. But for those patients you've mentioned without the limb, without who have dialysis, no, that's quite far gone. But still, we can control their blood glucose, of course, with insulin, because that's the most effective form of treatment. But there are other medications nowadays that are very life-saving, and it saves the pancreas as well. So there are a lot of new innovations when it comes to the drugs, but lifestyle modification is still a must in every step of the way.
Because the medicine, I suppose, is only there as a helper.
Yes.
It's not the miracle wonder that will take away your diabetes. Diabetes never goes away, I suppose.
Yes, it can only be controlled. So that's why I was mentioning remission. But there are other experiments right now wherein the cells of the pancreas producing insulin can actually be saved or maybe regenerate a bit. But that's really early research, but there's a chance that it might really help a lot of our diabetics, especially type 1s. We have to educate a lot of our fellow Filipinos that being Filipino by itself is already at a risk factor for becoming diabetic. So everyone should be should undergo screening, not just pre-employment. If you're 40 and above, screen. If you're younger, 20 or what, you have yourself screened as well, especially if your parents, you have a relative who's diabetic. Who among you would have a relative who is not diabetic? Meron yan. There's always one. So you have to have yourself screened. The problem nowadays is that some people do not want to know that because they know that there are certain limitations when it comes to diet. But then again, you have to tell them that as soon as you get diagnosed, if it's really early, you can be off some of the medications. Just do the lifestyle modifications advised of you. Stay off the red meats, stay off the sugar-sweetened beverages, lower your carb intake.
So you're saying, Mia, that, okay, they found out you're diabetic, there has to be intervention, medicine, maintenance, but if you actually exercise, as Amal was saying, if you do the lifestyle change, then you can actually be taken off the medicine.
That's true.
Hindi forever yung gamot.
Hindi. Not even insulin is for life nowadays, because there are really good drugs nowadays that can save your pancreas. But then you really have to be diagnosed early. If it's too late, you can be off some of your medication, minimal medications as possible, but keep on trying to do the proper lifestyle modification that's advised of you.
Okay, let me ask you, how expensive is it to be tested? Kung papatest mo yung bata or yourself, how expensive are the tests?
Well, if it's 75-gram OGTT, let's say fasting blood glucose would be about 100 pesos. So OGTT, that's about 300 pesos.
In a government facility?
In a government facility, yes.
Yeah, because there are people who will go to the nearest laboratory place and, it's so expensive. It's like, hello, there's a government hospital, they do it so many times, they're more efficient. Yeah, so it's not that expensive,
It's not that
300
expensive.
pesos.
And then if there's HbA1c, that would be a little bit more expensive. That's about 500 pesos. So all in all, well, a little less than $1,000 bucks.
I mean,
but then again, if
that's
you...
tragic. That's only one load.
Yes, and then it's a lifetime
phone,
of... Yes, that's true.
No, come on, Miguel. How much is a meal at Jollibee or McDonald's?
That's true. I mean, nowadays, like 1,000 pesos will get you maybe through the weekend if you're really on the budget meals. But this is 1,000 pesos to make sure that you are you have a condition or not. This is 1,000 pesos that will affect your entire life and will make sure that it will affect, it'll also ensure that you are possibly able to get off medication sooner if you're actually diagnosed early enough, right?